Milia also are called whiteheads. They are small, whitish, pearl-like masses in the epidermis. If your book says pear, they left the L off. It's pearl-like. They look just like the surface of a pearl when you see them. So milia or whiteheads are small, whitish, pearl-like masses in the epidermis due to retention of sebum. They can occur on any part of the face, neck, back, chest, and shoulders. Milia is usually associated with fine textured, dry types of skin. Acne. Acne is a skin disorder characterized by chronic inflammation of the sebaceous glands from retained secretions. It occurs most frequently on the face, back, and chest. Acne or common pimples is also known as acne simplex or acne vulgaris. Two basic types of acne are the simple acne and the more serious acne vulgaris. It's also advisable for the client to have the condition examined and diagnosed by the physician before receiving any service in the salon. In other words, we don't want to be messing around with it until the doctor says it's okay. You got to remember this is a scarring disease or disorder. Seborrhea is a skin condition caused by an abnormal increase of secretions from the sebaceous gland. An oily or shiny condition indicates the presence of seborrhea. It's not contagious. We're not concerned about catching it. Steatosis is a condition of dry, scaly skin due to a deficiency or an absence of sebum. It's caused by old age and by exposure to cold. Rosacea. Y'all was telling me a while ago about collagen elastin. You heard it on TV. Do you hear anything about rosacea on TV? They've not found a cure for rosacea because they still have not found the cause of rosacea. Until you find out what causes something, you usually can't cure it. But they have found some medication now that works well with a lot of clients that have rosacea. So rosacea was commonly called acne rosacea. It's a chronic congestion appearing primarily on the cheeks and nose. You can notify it or identify it by redness, by dilation of the blood vessels, and the formation of papules and pustules. The cause of rosacea is still unknown, but certain factors aggravate the condition. These include spicy foods, caffeine, alcohol, exposure to extremes of heat or cold, and also sunlight and stress. Steatoma is a sebaceous cyst or fatty tumor. It's filled with sebum and ranges in size from a pea to an orange. Usually appears on the scalp, neck, and back. Steatoma is sometimes called a wen. And what this happens is when it's filling up with sebum, it's backing into the skin instead of us seeing a blackhead. And we might see the pore getting a little bigger or the follicle getting a little bigger, but it stays down in there, and after a while we feel this hard lump, and then we try to get it out thinking it's something like a blackhead. And sometimes you're successful, but most of the time you've got to go have them surgically removed, because as they grow it begins to sometimes cause pain. Disorders of the pseudoauriferous or sweat glands. Anhidrosis is a deficiency in perspiration, often caused from a fever or certain skin diseases. This person needs medical treatment. Brama Hydrosis is foul-smelling perspiration, usually noticeable in the armpits or on the feet. And I might also caution you sometime about Brama Hydrosis. The foods we eat can sometimes be detected in our sweat, especially onions and garlic. Hyperhidrosis is excessive sweating caused by heat or general body weakness. Medical treatment is required for that. Miliaria rubra is prickly heat. It's an acute inflammatory disorder of the sweat glands characterized by the eruption of small red vesicles. It's accompanied by burning, itching skin. It's caused by exposure to excessive heat. You might notice babies, if they get real fat and have the little rolls of fat, they'll begin to get the prickly heat in between the little rolls of fat. Some inflammations of the skin. Dermatitis is an inflammatory condition of the skin. The lesions come in various forms such as vesicles or papules. And usually when we see somebody that's got some type of skin disorder, that's what we call it, is dermatitis. Just tell them you've got some form of dermatitis. Go to the doctor with it and let them diagnose it. Eczema is an inflammatory, painful, itching disease of the skin. May be acute or chronic in nature. Presents many forms of dry or moist lesions. All cases of eczema should be referred to a physician for treatment. The cause of it is also unknown, so there's no cure for it either. Herpes simplex, or fever, blister, or cold sore. This is a viral infection that recurs. It's characterized by the eruption of a single vesicule or group of vesicles on a red swollen base. The blisters usually appear on the lips, the nostrils, or other parts of the face. They rarely last more than a week, but they are contagious. Psoriasis is a skin disease characterized by red patches, covered with white silver scales usually found on the scalp, elbows, knees, chest, and lower back. Rarely occurs on the face. If irritated bleeding points occur, it's not contagious. We'll have a lot of people that have psoriasis come and want permanent waves or hair color or something. And we're going to usually notice it because right around the hairline, and I call that part of the face, the book says not, but it's right there, you can see it. They go into what they call the remission. There's periods of time you don't see the psoriasis. They can get a perm or something during that time, but when you're seeing them, you don't need to be messing with them, you know, and putting a chemical on because of irritating them. Occupational disorders in cosmetology. Cosmetologists must be sensitive to skin disorders not only in their clients but in ourselves. Frequent contact with chemicals results in abnormal skin conditions. We may develop allergy to the ingredients in some of our cosmetics or cold-waving lotions. They can cause eruptive skin infections known as dermatitis veniata. In our work, it's important that you employ protective measures. I keep a protective cream on my desk in there, and we also have gloves all the time. I want to talk about some pigmentations of the skin. Pigment can be affected from inside or outside the body in abnormal conditions such as prolonged exposure to the sun or other elements. Abnormal colorations also accompanies every skin disorder and many systemic disorders. Change in pigmentation can be observed as well when certain drugs are being taken internally. Excuse me. The following terms relate to changes in the pigmentation of the skin. Albinism. It's congenital leukoderma or absence of melanin pigment of the body. It includes the skin, the hair, and the eyes. Silky hair is white, the skin is pinkish white, and will not tan, and the eyes are pink. You have to keep these people out of the sun because they'd really blister. They age early. I was looking and picked up this magazine for Fred and Clint one day last week, a hunting magazine, and it's supposed to be just about Georgia, something about Southern sportsmen or something. And there was a picture that somebody's field camera had taken of an albino deer. And that deer was just totally, was strange looking really, totally white. Chloasma. It's a condition characterized by increased pigmentation on the skin in spots that are not elevated. Chloasma might also be called moth patches or liver spots. And yesterday they was referring to the dark spots that people get when they're pregnant and all. This is just what we're talking about. Lentigines or lentigo is a technical term for freckles, and we know we're not worried about that. Leukoderma is a skin disorder characterized by light, abnormal patches caused by a burn or a congenital disease that destroys the pigment-producing cells. It is classified as vitiligo or albinism. So let's talk about vitiligo. Vitiligo is milky white spots or leukoderma of the skin. It is an acquired condition. These individuals must be protected from the sun. This is what Michael Jackson was said to have had. There's been several of our stars that have had it. But they just gradually, place to place, lose the pigmentation of their skin.
So he didn't do that on his own?
I don't know, some people believe he did, you know, but vitiligo goes along the same avenue as what occurred with him. And I notice he always uses an umbrella. Of course, if he could have done that on his own through bleaching agents, he would have had to have protected his symptoms. I don't know. But they did say he had vitiligo. Nevus, small or large malformation of the skin due to abnormal pigmentation or dilated capillaries, commonly known as a birthmark. We're not concerned about that. A stain is an abnormal brown or wine-colored skin discoloration with circular and irregular shape. Its permanent color is due to the presence of darker pigment. Stains occur during aging, after certain diseases, and after the disappearance of moles, freckles, and liver spots. The cause is unknown. But aging, if you'll notice, a lot of people call them age spots. They begin to get them on their arms and hands. A tan is a change in pigmentation caused by exposure to the sun or ultraviolet rays. Now some hypertrophies of the skin. Hypertrophy of the skin is an abnormal growth of the skin. Many hypertrophies are benign or harmless, and we're not really that concerned about them. What we're concerned about is the ones that are not. Keratoma is an acquired superficial thickened patch of epidermis commonly known as callus. It's caused by pressure or friction on the hands and feet. If the thickening grows inward, it is called a corn. Mole is a small brownish spot or blemish on the skin ranging in color from pale tan to brown or bluish black. Some are small and flat and look like freckles. Others are raised and darker in color. Large dark hairs often occur in moles, and any change in a mole requires medical attention. We never remove hair from moles. Skin tag is a small brown or flesh-colored outgrowth of the skin. Skin tags occur most frequently on the neck of an older person. And as bad as I hate to say this, because I know I'm not older, I've got several. Verruca is a technical term for wart. It's a hypertrophy of the papillae and the epidermis. It's caused by a virus. We hear that? It's caused by a virus. It is infectious. Can spread from one location to another, particularly along a scratch in the skin. Now our skin cancers. Skin cancer from overexposure to the sun comes in 3 distinct forms, varying in severity. Each is named for the type of cells in our body that it affects. Basal cell carcinoma is the most common. Thank goodness it's the least severe. It's often characterized by lighter pearly nodules. Squamous cell carcinoma is more serious than basal cell carcinoma and is often characterized by scaly papules or nodules. The third and most serious form of skin cancer is malignant melanoma. It's often characterized by black or dark brown patches on the skin that may appear uneven in texture, jagged, or raised. Malignant melanomas often appear on individuals who do not receive regular sun exposure and are most commonly located on areas of the body that are not regularly exposed, often called the city person's cancer. Malignant melanoma is the least common but the most dangerous type of skin cancer. Detected early, you have a good chance of survival and cure rate. So whenever you notice anything, whether it's on you or one of your clients, make note, tell your client, get it seen about. So now that we know some of the maladies of the skin, we want to talk about how to maintain the health of the skin. We know that vitamins and dietary supplements are all out there, and creams and all that, and it's a matter of getting the right thing in the right amount. The best way to take care of your skin is to drink plenty of water to hydrate it, and to eat properly and not depend on eating a hot dog and potato chips for dinner and supper and breakfast and then going and getting a bottle of vitamins. Because our body actually uses our food better than it does vitamin supplements. Vitamins play an important role in the skin's health, often aiding in healing, softening, and fighting diseases of the skin. Vitamins such as A, C, D, and E have all been shown to have positive effect on the skin's health when taken internally. Although experts agree that taking vitamins internally is still the best way to support the health of the skin, some external applications have also been found to be useful in nourishing the skin. Vitamin A supports the health of the skin. This vitamin aids in the health, function, and repair of skin cells. Vitamin A is an antioxidant that can help prevent certain types of cancers, including skin cancer. It has been shown to improve the skin's elasticity and thickness. In its topical acid form as the prescription cream called retinoic acid or retin A, vitamin A can be used to treat many different types of acne. Vitamin C, also known as ascorbic acid, is an important element needed for proper repair of the skin and other various tissues. This vitamin aids in and even speeds up the healing process of the body. Vitamin C is also vitally important in fighting the aging process. It promotes the production of collagen in the skin's dermal tissues, keeping the skin healthy and firm. Vitamin D promotes the healthy and rapid healing of the skin. The best source of this vitamin is sunlight in limited amounts. You know, all of our growing up years, most of us was taught that vitamin C was the sunlight vitamin, and now we find out vitamin D. Because vitamin D helps to support the bone structure of the body, it has been made readily available in fortified foods and dietary supplements. Vitamin E, used in conjunction with vitamin A, helps fight against and protect the skin from the harmful effects of the sun's rays. Vitamin E also helps to heal damage to the skin's tissue when used both internally and externally. Water and sun. We need to drink a lot of sun, drink a lot of water, get a little bit of sun, keep our faces and skin cleansed and exfoliated. Should relieve us of problems. Do we have questions? All right.